All right, welcome back. In our last explainer, we really dug into this central command center, the brachial plexus. Well, today, we're following those main lines down the arm to meet the elite special forces on the ground. These are the 5 key nerves that turn your brain signals into real action. I mean, it seems so simple, doesn't it? You see the cup, you decide you want it, you reach out, and you grab it. But underneath the skin, there is this incredibly fast, super complex electrical conversation going on between your brain and your hand. It's just amazing. So, to make sense of all this, I want you to picture the 5 major nerves of your arm as a team of highly trained specialists, like a commando unit. Each one has a very specific mission, a unique set of skills, and its own territory to cover. Now, these 5 operatives, they come right out of the brachial plexus, and each one heads down the arm with a very specific job to do. They're the ones in charge of every muscle twitch and every sensation that gets sent back to headquarters. So let's meet the first member of the team. First up, we've got the median nerve. If your hand has a team captain for gripping, for pinching, and for all that fine motor control, this is it. This is the nerve that lets you hold a pen, button your shirt, or, grab that morning cup of coffee. So let's look at its job description. On the motor side, the what it moves side, it's in command of most of the flexor muscles in your forearm. And super important, it controls the thinner muscles that give your thumb all its power. Then on the sensory side, it's gathering all the intel, all the feeling from the palm, your thumb, your index and middle fingers, and about half of your ring finger. And here we can see that sensory territory on a map. Just look at the area that's highlighted. That's the median nerve zone. It's a huge patch of real estate, which is exactly why it's so vital for our sense of touch and our ability to interact with the world around us. And get this, one of its tiniest branches, the one that goes to the thumb muscles, has a nickname, the $1,000,000 nerve. So why do they call it that? Well, because it is so important and so easy to accidentally damage during wrist surgery that injuring it can lead to some massive legal claims. So what happens when this nerve's command line gets cut? Well, if the injury is way up in the arm, a patient loses power to the muscles that bend the index and middle fingers. So when you ask them to make a fist, those 2 fingers just stay straight up, creating what's called the sign of benediction. It's a really clear visual cue that the median nerve is in trouble. Okay, let's move on to our next specialist and see how this all fits together. Meet the ulnar nerve. Now, if the median nerve is all about that powerful grasp, the ulnar nerve is the artist of the team. It's the fine-tuner, responsible for all the intricate, delicate movements of your hand. Its motor supply really tells the whole story. In the forearm, it only handles 1.5 muscles, but once it gets into the hand, oh, it's the boss. It controls most of the small, intrinsic muscles, the ones that let you do things like spread your fingers apart or bring your thumb in tight, all those complex little tasks. And looking at our map again, we can see the ulnar nerve's very distinct territory. It handles the sensation for your pinky and the inner half of your ring finger, on both the front and back of your hand. See how it fits perfectly next to the median nerve zone? It's like 2 pieces of a puzzle coming together. Okay, now for a real clinical mind-bender, the ulnar paradox. When this nerve gets injured, it can cause something called a claw-hand deformity. But here's the really weird part. A severe injury way up at the elbow actually results in a less obvious claw than an injury down at the wrist. How is that possible? Well, because the high injury also paralyzes the muscles that curl the fingers, so they literally can't pull into that tight claw shape. The worse injury actually hides the sign. So how can you test this nerve's function? It's actually really simple. You just need a piece of paper for what's called Frohman's test. You ask the patient to pinch it really firmly between their thumb and index finger. A healthy ulnar nerve uses the adductor pollicis muscle for a strong, flat pinch. But if that muscle is weak, the patient cheats. They compensate by firing their thumb flexor, which, remember, is powered by the median nerve. That bent thumb is a dead giveaway that the ulnar nerve is having a bad day. Our third commando is the absolute powerhouse of the group, the radial nerve. Its primary mission, its one big job, is extension. Straightening your elbow, lifting your wrist up, opening your fingers, that is all the radial nerve. And its jurisdiction is just massive. It commands the triceps to straighten the elbow. Then, its deep motor branch, which is called the posterior interosseous nerve, or PIN for short, that branch takes care of the entire crew of extensor muscles in the forearm. It is the direct opposition to the median nerve's team of flexors.
And for one last time on our map, you can see how the radial nerve completes this sensory puzzle. It covers pretty much the entire backside of the arm, the forearm, and the hand. So between these three big nerves, the whole hand is covered.
Now, what's really cool about radial nerve injuries is this incredibly memorable pattern. If you injure it way up high in your armpit, like from falling asleep with your arm over the back of a chair, which they call Saturday night palsy, you get 3 drops. You can't extend your elbow, your wrist, or your fingers. If the injury is a little lower down around the humerus, it spares the elbow, so you get 2 drops. And if you only injure its motor-only pin branch, you just get 1 drop, a finger drop, and no sensory loss. It's as easy as 3, 2, 1.
Okay, our final 2 operatives focus more on the heavy lifting and the positioning of the entire arm. Think of these as the upper arm specialists who control the shoulder and the bicep.
First up is the musculocutaneous nerve. Let's call it the bicep boss. Its mission is to power the muscles on the front of your arm for a really strong elbow flexion. Then you have the axillary nerve, the shoulder guard. This one can get injured with shoulder dislocations, and it powers the big deltoid muscle. That's the one that lifts your arm out to the side and gives your shoulder that classic rounded shape. And its little sensory patch, right over the deltoid, is called the regimental badge area. So, as you can see, these 5 nerves are not working alone. Not at all. They are a perfectly coordinated team. It's like a symphony of signals where each player has a vital and very distinct part to play.
So, let's do a quick recap of our team. The median nerve is your grasper. The ulnar nerve is your fine-tuner. The radial nerve is your powerful extender. And the muscular cutaneous and axillary nerves are your upper arm and shoulder specialists. Together, they make possible the incredible range of motion and sensation we have in our arms and hands.
So the next time you pick up a cup, or type on a keyboard, or even just wave hello, take a second to remember that commando team at work, a perfectly coordinated symphony of 5 specialists, turning a simple thought into motion. You know, it really makes you realize that every single part of our body has its own hidden team, its own secret language, just waiting for us to explore it.